Welcome back, Smile Share Nation. Apologies, 105, but we almost got it right on time. So thanks for tuning in with us. Hopefully you stood by for those extra 5 minutes and had a little bit of lunch. Happy February 22nd, 2022. I feel like I should be Chuck Willery today with, we'll be back with you on 2 and 2 for you, those of you old timers that remember Chuck Willery in the dating game. Anybody out there? Chuck Willery, 2-2, love that guy, man. So Smile Share Nation, we're here to talk with you today about another great topic. We're talking about phased orthodontic treatment. There's usually a lot of questions that come up around this topic. How many phases of orthodontic treatment are there? What's the value in them? I hear kids are getting braces earlier and earlier a lot of the times. And so we thought we'd try to clear up some of that confusion, entertain some questions. Crystal and Miss Brittany, shout out. Thank you for putting some questions and some information for us to review together today. But before I jump into the content, I have to get in a little bit of fun, right? So last time we talked with you guys, right? My beloved Rams are going to the Super Bowl, and guess what? We're champs. How about that? Woo! And so, with this little rain, I thought that I'd pull out the little beanie today to celebrate. February's almost over, so the gloating, it will probably have to be dialed down a little bit in the next coming weeks. And fortunately, baseball season's going to be starting, so fingers crossed that there's actually a spring training, and we get to play some big boy ball. I know the little leagues are getting ramped up, and it's nice to hear that the kids are playing softball and baseball now, and so we love team sports and we love supporting our youth at Pesh Orthodontics. And shout out again to Sean McVay and the Rams organization. Great game and fantastic victory. So with that said, I will get into the content. Today, again, phases of orthodontic treatment. So how many phases are there? Phase 1 is early treatment. Phase 2 is sometimes called full treatment. Phase 3 is not really a thing. It's when you're back into the office because you didn't wear your retainers, and then we're starting treatment again. So we want to avoid phase 3, all right? The majority of our patients are able to do just a one-phase treatment. We wait for most of the adult teeth to come in, and we're ready to go. But we don't know if you're going to be that candidate to be a full treatment, one phase and done kind of a patient, unless we are able to screen a little bit earlier, right? So it doesn't matter if we're talking orthodontics or we're talking breast cancer or prostate cancer or any of the other things that come into affect our lives. Early detection is the key, even with malocclusion. So the American Association of Orthodontists recommends screening by age 7 for all kids. That doesn't mean we're putting braces or starting phase 1 or early treatment on all our little ones. But we're able to screen for some bigger issues with growth and development that could lead to more treatment and more expense later down the line, right? So that's where early treatment comes in. So the differences, let's see, we got differences between phased treatment and comprehensive treatment. Again, most cases can be treated in one comprehensive treatment, but some cases benefit from 2 phases of treatment. Some of those specific instances are when we're trying to help the jaw Jaws developed to ensure adequate space for all the permanent teeth, especially the permanent canines, which are on the corners. Often we run into cases where we have impacted canines that need to be exposed and bonded surgically to bring them in, whereas just doing something as simple as a palatal expander can create enough room for those to come in and for us to avoid needing to remove permanent teeth, which is usually fantastic. Which was another point. Some problems that can be treated quite well in a growing child may require corrective surgery, like the expose and bond that I mentioned, or issues with the upper jaw or lower jaw if treatment occurs after growth ends, which for girls, growth ends a little bit earlier than for boys. But when the kids come in at age 7, 8 is great, 9 is fine. We can plan for those things, and it works out much better as far as the overall facial balance and aesthetics on those cases that actually necessitate phase 1 and go into a second phase later. These are all my opinions, right? So there are orthodontists across the country that are fantastic. There's not consensus on whether or not people tend to treat or utilize phase 1 treatment modalities. There are, it kind of goes back to the debate on extraction versus non-extraction. Every practice has their own percentage where they, some practices are at 50%. They'll extract half of the time and the other time they won't. Other practices are 80-20, right? You get into the same issue when you're talking about early treatment on, what types of methods and protocols that a specific dentist or orthodontist will use if they utilize phase 1 and so or not. So again, some of you know that I trained at Loma Linda University, had a great experience there. The philosophy at Loma Linda really stemmed from Dr. Robert Ricketts, who was big on research and growth and development and saw an opportunity there where phase 1 or early treatment could really benefit patients, right? And so there's been debates, and I'm getting in the weeds probably, Crystal, but Lyle Johnson, Robert Ricketts, it's like tastes great, less filling. There's debates in all areas, and so over time, you find out what works best in your hands as a practitioner and as an orthodontist. And in our practice here at Pesh Orthodontics, there is a place for early treatment. And so, and some of the goals are to normalize the relationship of the upper jaw to the lower jaw, especially cases when we have an underbite, right, or a bulldog bite, a class 3 bite. Class 2 bites, most of the time we'll wait for growth until girls are 11, 12, boys 13, 14. We can wait until the growth spurt is going to hit to catch that when the jaw's set further back. On the underbites, we like to get in there a little bit sooner, okay? If there is an issue with kids having goofy habits like sucking on their thumb or leaning on their chin or mouth breathing, these are all things that we can actually do something, especially airway issue, right? So airway issue is something that's near and dear to my heart. There is an increased incidence of childhood sleep apnea, right? And that affects a lot of kids, and they can self-medicate by sucking on their thumb or another digit to help open the airway at nighttime. These kids have issues with enuresis or bedwetting. Sometimes you'll see dark shiners or shadows under the eyes from not getting enough oxygen when we're sleeping, not getting enough good, REM sleep. So something simple as, again, I go back to the palatal expander because it's been around for a long time. There's people that have knocked it, but it's really tried and true for being able to skeletally expand with true expansion the maxilla or the upper jaw, and it can increase volume in the sinuses and help with nasal respiration when we're breathing through our nose, because the tongue should stay up on the roof of the palate if we're breathing through our nose. Otherwise, if we're breathing through our mouth, the tongue stays down and the upper jaw can collapse. Sometimes it's an issue with adenoids or tonsils. So these are all things that we look at. We're not just looking at the teeth as orthodontists, and that surprises a lot of people, but we have a unique opportunity as orthodontic specialists to help screen for some of these bigger picture issues. If you're not getting enough sleep, and a child has early sleep apnea, it affects the amount of oxygen into your brain, and it can affect the test scores and our ability to learn. One of the things I'd like to do is figure out the timing on this, right? I know.
So it doesn't fall asleep.
Always do better, right? Okay, but I digress, okay? As sometimes I do. So another instance for early treatment or phase 1 treatment is when the top teeth are out in front of the bottom teeth more than 6 millimeters. Those cases sometimes can really benefit, because there's research that talks about those teeth being more susceptible to fracture, especially when we've got active kids, right? And so when we have these permanent teeth in the front, even at age 7, but they're at risk of injury and we can do something about it, I would want to do that with my kids, right? And so there are a handful of reasons, some of them we talked about, where early treatment is beneficial. If we don't have any of those, then kids go into our growth and observation program. So it's all part of our 7 and up program about early screenings, okay? So again, early diagnosis is better. We talk about goals for phase 1. I hit on a bunch of these already, I think. We want to guide permanent teeth into a more favorable position, help develop facial and jaw growth, correct harmful oral habits, reduce the severity of the case and subsequent future treatment, and improve bite, and a big one is self-confidence, right? So there, time and time again, patients will come in for consultation, or they'll submit in pictures through our virtual link online, and there is what is medically necessary and what is going to be orthodontically beneficial, but we also are sensitive to the fact that sometimes just kids are getting bullied because they don't like the way their teeth and jaws are developing, and that can be a big thing. And so even when that's the only issue, for years our specialty has kind of minimized that, but it's kind of come back to the forefront, where especially with the AAO's anti-bullying campaign, and we'll be bringing that back come September, October this next coming year. But it's a real thing, and it affects a lot of families, and we need to talk about it more. But as orthodontists, we can help, and that's one of the other things. It's lower down on the list for many, but the importance and impact is very significant, right? So common therapies that we use in phase 1 to achieve our goals are the expander, limited braces, and a great new treatment modality that our patient has been benefiting from is from Invisalign First, right? And so, Brittany, maybe you can see this. Catch. Good job. So Invisalign First, great hands, is Invisalign for the little ones, right? And so you would be surprised at how compliant the kids are at 7, 8, 9, right? It's not a fit for everybody, but it is a fantastic way to achieve some of our treatment goals with still being able to brush and floss and normal and keep impeccable oral hygiene. All right, what else we've got? One key thing is with kids going into phase 1, we usually always try to give them a break. And so when we don't get to see the kids until 9 or 10 for their first screening, sometimes there's something that we have to jump in on that's emergent. Most of the time we'll try to wait, right? But if that first phase goes into the second phase, it doesn't make for as good of an experience. So the first phase of treatment are, the handful of reasons that we can jump in, we get in, get out. Typically, it's anywhere from 6 months to a year of active treatment. And then we let the kids breathe and grow. And that is really important so that we don't get burned out on the process or treatment dragging on, forever and ever and ever. You hear some stories about patients being in braces for 5 or 6 years and it just breaks your heart, right? So one of the keys to that is the early screening at age 7 to see if you're a candidate for early treatment to avoid some of those issues. And then, being evaluated for a second phase of treatment. Now, just because you have phase 1 treatment, it's not a given that you're going to need a second phase of treatment, but I would say it happens 80% of the time, okay? Goals for phase 2, okay? So why, after you had first phase treatment, would somebody ever think about or why would they need a second phase of treatment? And the reality is not all the adult teeth are in at that time. Did we have some questions?
No, we were just saying hi to our viewers.
Okay, that's great. Who do we got tuning in with us right now?
We have Sydney Mata. We have Ready to Smile Dental.
Great.
We have...
Good to see you, Dr. Reddy and Sydney. Thank you for tuning in with the rest of Smile Share Nation.
Sophia Ellis, Kellyanne Pedler, Jennifer Dillon.
That's great.
Yeah.
Thank you for joining us. Sometimes I think I'm just talking to Crystal and Brittany.
Which is important.
Which is important. But we do know, and we've been getting great feedback from our Smile Share Nation and friends that, if you don't have time to watch this or all of it and you tune in, you pop in and pop out and you're able to share this link with some friends that are maybe looking for orthodontic treatment or just some good information or entertainment. We're going to work on the entertainment value as time goes on, but thank you for joining us. So phase 2 goals, again, is to make sure the teeth are in their proper places for good function, a healthy bite, and a pleasing appearance. It's really the fine tuning, okay? And then in some of the cases when we're dealing with the real retrognathic cases or trying to facilitate the growth and development of the lower jaw, we tackle those then, So let's see. I've jumped around a lot today.
Like, where are you?
I have no, but you know what I do know? It's February 22nd, 2022.
Tuesday.
Man, I'll tell you a funny story. So, any of you guys have second graders out there? They are having a blast today. Stella, my youngest, is in second grade, and they later because it is just adorable. Her teachers at their school, they made these beautiful t-shirts, and they're just pumped. And then I was talking with Crystal because she also has little ones too, and they're like, what was it?
Tutus and tiaras.
Tutus and tiaras. I mean, I know Taco Tuesday and Mexican restaurants are just having a field day today. I guess I was told when I was talking with a patient earlier about Taco Tuesday, like just being off the chain today. They're like going, yeah, and it's National Margarita Day too. And I'm like going, that is like a lunar eclipse of the best kind, right? So anyway, I just love it. This pandemic has really made us appreciate some of the little things in life, as well as connecting with people. go out there, support your local favorite Mexican restaurant today on Taco Tuesday, you know, and
You do have some questions.
we got, is it my favorite taco?
No.
No.
But that is a good question since you asked.
I will give a shout out to Aztec Tacos in South Temecula. They're fantastic. I love their ceviche. So shout out Aztec. You're doing a great job. What's the question, Crystal?
How often should my child see an orthodontist if they're seeing them as early as 7?
That's a great question. So typically we'll see kids back on every 6 months to a year, depending on what we're monitoring. It really has to do with what we see on the panoramic x-ray. And as much as we love our virtual consultations, we still try to get patients in to take that baseline x-ray so we can count and make sure we don't have any extra or missing teeth. But we can get a lot of information from the virtual consult, and we'll drop that link in the comments later too to make sure you guys have that and can share that. So fantastic question. We're even developing now with our Pesh Remote a way to do these types of visits without having patients have to miss school or miss practice and things like that. But it's, if we're 7 and it goes like it mostly goes, and we see that we've got all our teeth, nothing's missing, we don't have any goofy habits, there's no airway issues, and we're gonna watch growth and development. Usually it's a check-in every 12 months. So we'll check you a couple times before we feel like there's gonna be readiness and the teeth are ready to start full orthodontic treatment, right? Great question. Did I answer that okay?
You did.
Okay.
Yes. What if I decide against getting 2 phases of orthodontic treatment?
Great question. And that happens. Sometimes we're just not ready, and sometimes it increases the chance that permanent teeth are going to need to be removed, and sometimes that's the case anyway. We're pretty good at being able to develop arches to create room for the teeth and avoid extractions. I'm not a big extraction orthodontist personally. I enjoy looking at faces that are fuller, and form follows function. So a lot of times when we don't have room for the teeth, there's something else going on. There can be genetic predisposition, where we got mom or dad's teeth and vice versa, or mom or dad's jaws and they just don't match up. But removal of permanent teeth, which we can deal with, but I believe that overall facial balance and outcome on patients that have had early treatment when there's one of those issues, that aesthetically things look better. So, and that's just my personal take, so, and then there's issues sometimes where if there's a jaw growth issue, and depending on where we're catching it, if we're catching it and the kids are coming in at 14 or 15, and they're close to the end of growth, there isn't much we can do other than camouflaging the treatment with extractions or doing some other, making some other compromises in the treatment, or we're looking at orthognathic jaw surgery, right? And so if we can avoid those things, we like to. It doesn't mean we don't have options for those patients. We always talk about, orthodontics being something for people age 7 to 70, right? And we've got even patients beyond 70 that are taking advantages of the benefits that orthodontic treatment can provide, right? So, it's never too late, but if I could wave a magic wand and I could avoid taking teeth out or avoiding jaw surgery, I would do it every time, and that's just me. Doesn't mean that we don't have a lot of patients that we do treat with extractions or with jaw surgery, just because, for whatever reason, either parents, we couldn't afford it at the time, people are moving around. Interesting case came in earlier this last week that was referred by one of the oral surgeons that we work with. This gentleman had a severe malocclusion and it hadn't been dealt with. There had been things that had been changing with growth and over the time, but he had bounced around from state to state and from dentist to dentist, and had never been in a place long enough to address some of the issues. And you know, he's in his 50s now, right? And so, but he's ready to do something about it. And so, in this case, in his particular case, it's a jaw surgery play. You know, so I don't know if that answered the question, but
I think so.
hopefully it did. Okay.
And how long does each phase typically last?
Another fantastic question. The question was, how long does each phase typically last? So say phase 1 treatment, again, we try to go 6 to 12 months, right? Sometimes there's retainer part of that, and so it can be 12 to 18 months, but our target is get in less than a year, get in and get out, okay, and let the kids grow. Do what we absolutely have to do and let the kids grow, okay? And a second phase of treatment after, say, a year is most commonly another 12 to 18 months, okay? So it's true that 2-phase treatment can take a little bit longer than full treatment, because most full treatments, and by that, we're doing it just one go, is typically about 18 to 24 months. There are some cases we're getting to 12 months, right? Relapse cases are usually around 6 months. But if you add it up and you're going, okay, 12 and then another 12 to 18, well, that's longer than 2 years, and it's more expensive and an. So there's definitely a cost associated with doing 2 phases of treatment, which we try to avoid. But in those cases where it's needed, I think the overall balance of facial aesthetics and oral health is better, and this is my opinion, than those other cases, right? It depends on what you're focusing on. If you focus on, you know, the teeth and just the teeth, you may not be able to make a good argument for 2 phases. But if you're looking at the teeth, facial balance, airway, and some of these other things, I think it makes a lot of sense, okay? Did I ask? And then phase 3, right?
Phase 3. When I heard you say phase 3.
What's that?
You threw me off when I heard you say
I know.
phase 3.
Well, phase 3 is, we don't do phase 3. But phase 3 would be those cases that come back, right? So for retreatment, because we didn't wear our retainers, and we gave a little bit of information about that last time as far as retainer wear and what the best what the best kind of retainer is and how long you have to wear them. So if you didn't catch that episode, you can tune in and to a replay from a couple weeks ago, and that was before the Rams won the Super Bowl, but now they did win the Super Bowl. And how does that relate? I don't know, but it's just, gotta love the Rams. You're not champs every year, so you gotta celebrate, right? Just like it's Taco Tuesday on 2/22/22. It doesn't happen every day, so go out there, celebrate. I think that's all the time that we have for today. Thank you for tuning in. Keep smiling, and March 8th. So we'll be back on March 8th. It's another Tuesday. We hope to have another face on here besides mine, and to maybe entertain you guys better. So hopefully you were entertained or learned a little something. With that, we'll see you next time.